Assalamualaikum warahmatullahi wabarakatuh. Good morning. The Honorable Rector of Universitas Airlangga, to whom represented by Vice Rector of Universitas Airlangga for Internationalization, Digitalization, and Information, Dr. Muhammad Miftahus Surur, MKes PhD, Internist Consultant. The Honorable Dean of Medical Faculty, Universitas Airlangga, Profesor Dr. Budi Santoso, Gynecologist, Consultant. The Honorable Head of Othorhinolaryngology Head and Neck Surgery Department, Dr. Muhtarum Yusuf, Othorhinolaryngology Head and Neck Surgery Consultant FICS. The Honorable Professors of Othorhinolaryngology Head and Neck Surgery Department. The Honorable Study Program Coordinator of Othorhinolaryngology Head and Neck Surgery Department, Dr. Artono, Othorhinolaryngology Head and Neck Surgery Consultant FICS. Senior staff members and dearest residents. Last but not least, the Honorable Professor Seok as the Adjunct Professor of Othorhinolaryngology Head and Neck Surgery Department, Medical Faculty, Universitas Airlangga, Dr. Sutomo General Hospital, Surabaya, and to all our distinguished guests. Today is Thursday, August 26, 2021. We are in the Adjunct Professor Inauguration Ceremony organized by Othorhinolaryngology Head and Neck Surgery Department, Medical Faculty of Universitas Airlangga, Surabaya, Indonesia. In this precious opportunity, Othorhinolaryngology Head and Neck Surgery Department has proudly invited Professor Seok from Yonsei University College of Medicine, Department of Othorhinolaryngology, Seoul, South Korea. Before we start our inauguration ceremony, may I bring the rundowns programs today. First opening, continued by National Anthem Indonesia Raya, followed by Hymne Airlangga, curriculum vitae reading, opening speech by Head of Othorhinolaryngology Head and Neck Surgery Department, welcome speech by Dean of Medical Faculty Universitas Airlangga, scientific oration by Professor Seok, ceremonial formal speech by Rector, represented by Vice Rector of Universitas Airlangga, the inauguration ceremony, and closing. Thank you for your attention. Shall we start our inauguration ceremony? First of all, let us praise to Allah Subhanahu wa Ta'ala. Because of His blessings, we can help and participate in this event. As our love and proudness to our homeland Indonesia and alma mater, we will listen to National Anthem Indonesia Raya, followed by Hymne Airlangga. To all guests, please put your right hand to the left chest for Indonesia Raya.
Bangsaku, bangsa
Thank you. Without further ado, the first agenda is Curriculum Vitae Reading by Dr. Nyilo Purnami, Othorhinolaryngology Head and Neck Surgery Department, FICS, FISCM. Dr. Nyilo, the time is yours.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. I would like to read the curriculum vitae of Professor Seok, medical doctor, otorhinolaryngologist, head and neck surgeon. He was born in July 10, 1974 in Seoul, Korea. The position is professor in Department of Othorhinolaryngology, Severance Hospital, Yonsei University College of Medicine, Seoul, Korea. The experience in education and training. He has completed medical doctor in Yonsei University Department, Seoul, Korea in February 1999, and he was completed intern in Yonsei University Department in February 2000 in the field of surgery. He has completed as resident in Yonsei University Department of Medicine, Seoul, Korea in February 2004 in the field of otorhinolaryngology. He was completed the visiting resident in House Ear Institute, Los Angeles, California in the field of otology. Is completed in PhD in otology in Yonsei University, Seoul, Korea on August 2011. He has completed visiting scholar in otology in University of Antwerp Hospital, Antwerp, Belgium. He's completed the visiting scholar in Marseille University, Marseille, France in March 2015. He has completed the postgraduate research fellow in Massachusetts Eye and Ear Infirmary, Boston, Massachusetts in August 2018 in the field of otology and neurootology. The personal statement. He is neurootologist from Yonsei University College of Medicine and devoted to lateral skull-base surgeries and endoscopic ear surgeries. Worst foremost experience in active middle ear implant surgery, more than 200. Asia's first experience of total transcanal endoscopic acoustic tumor removal. Korea's first experience of ABI in NF2. More than 500 cases of vestibular schwannoma surgeries and more than 100 cases of external auditory canal carcinoma surgery. The position from 2007 until 2008 as Clinical Fellow, Department of Othorhinolaryngology, Otology Division, Yonsei University Medical Center. From 2008 until 2011 as Clinical Assistant Professor, Department of Othorhinolaryngology, Otology Division, Chung-Am University College of Medicine. From 2012 until 2013 as Assistant Professor, Department of Othorhinolaryngology, Otology Division, Yonsei University College of Medicine. From 2014 until 2020, Associate Professor, Department of Othorhinolaryngology, Otology Division, Yonsei University College of Medicine. In 2021, as Professor, Department of Othorhinolaryngology, Otology Division, Yonsei University College of Medicine. In 2021, Chairman Department of Othorhinolaryngology, Gangnam Severance Hospital. And experience in the committee from 2012 until 2014, Education Committee, Korean Audiologic Society. From 2013 until 2014, Planning Committee and Korean Otologic Society, 2013 until 2016 as Director, Education and Training Committee, Korean Skull-Based Society, 2014 until 2015 Medical Affairs Committee, Korean Society of ORASI, 2016 until 2018 Academic Committee, Korean Society of ORASI, 2019 Director, Publishing Committee, Korean Skull-Based Society, 2020 General Secretary, Korean Pediatric Society of Othorhinolaryngology, 2021 Director, Academic Committee, Korea Othorhinolaryngology Head and Neck Surgery, 2021 Director, Information Committee, Korean Audiologic Society. As Editorial Boards, 2012 Editorial Board, Yonsei Medical Journal, 2019 Editorial Board, Scientific Reports. And the award achievement on September 20 and 20, Best Paper Award, Korean Othorhinolaryngology Society. On February 2018, Best Paper Award, North American Skull-Based Society. April 2016, Best Paper Award, Korean Otologic Society. May 20 and 12, Best Paper Award, Korean Audiologic Society. 2011, Best Award, Korean Skull-Based Society. April 2006, Minister of National Defense Award. And the contribution to the science. Contribution to endoscopic ear surgeries. He's published 5 articles associated with EES and holds endoscopic ear surgery hands-on workshop every year. And the website is follow. The publication articles as follows, start from 2018 until 2021. And the development of new treatment for vestibular schwannoma, he has endeavored to develop cheap and efficient vestibular schwannoma xenograph models and have explored new treatment modalities for vestibular schwannoma growth suppression, including plasma and sulforaphane. Machine learning prediction for vestibular schwannoma surgery outcome was also addressed. The publication articles start from 2016 until 2020 as follows. And the improvement of conventional treatment of hearing rehabilitation. He has sought to redefine conventional hearing rehabilitation methods for existing and novel auditory implants and to improve conventional medical treatment for patients with hearing loss. The publication articles start from 2011 until 2021 as follows. The complete list of published works, including 95 peer-reviewed, published and accepted journal papers, on 50 of which he is the first or last author, that can be checked in the website below. And the research support in 2021, Korean Healthcare Technology R&D Project for Health, Welfare and Family Affairs, the title Development of Smart Application for Tinnitus Treatment. In 2018, National Research Foundation of Korea, the development of adjuvant treatment using cold atmospheric pressure plasma for skull-based tumor. In 2017, research grant of Korean Institute of Industrial Technology. The title is Development of Health Food for Presbycusis using avocado component. In 2016, research grant of Yonsei University College of Medicine. The title is Development of Novel Zebrafish Human Head and Neck Cancer and Skull-Based Xenograft Model for Effective Cancer Treatment During Drug Screening. In 2014, National Research Foundation of Korea. And the title is The Detection of Gene Mix Involving Auditory Hair Cell Regeneration After Noise-Induced Cell Damage and Development of Knockout Model Using Zebrafish. In 2013, Korean Healthcare Technology Research and Development Project for Health, Welfare and Family Affairs. The title is Feasibility of Auditory Brainstem Implants in Non-Tumor Patients. In 2012, Research Fund of Yonsei University College of Medicine, the title Development of Novel Zebrafish Human Vestibular Schwannoma Xenograft Model. In 2012, National Research Foundation of Korea, the title is Mass Drug Screening for Therapeutic Agents Against Noise-Induced Hearing Loss. In 2010, Korean Healthcare Technology Research and Development Project for Health, Welfare and Family Affairs. The title is Detection of MicroRNA Related to Noise-Induced Hearing Loss Using Zebrafish. 2009, Korea Healthcare Technology Research and Development Project for Health, Welfare and Family Affairs. The title is Mass Drug Screening for Therapeutic Agents Against Ototoxic Hearing Loss. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Nilo. Next agenda is opening speech by Head of Othorhinolaryngology Head and Neck Surgery Department. To Dr. Muhtarum Yusuf, Othorhinolaryngology Head and Neck Surgery Consultant FICS, you may begin your speech.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. The Honorable Rector, to whom represented by Vice Rector of Universitas Airlangga for Internationalization, Digitalization, Information, Muhammad Miftahul MD, MCAS, PhD, Internist Consultant. The Honorable Dean of Medical Faculty, Universitas Airlangga, Professor Dr. Budi Santoso, MD, Gynecologist Consultant. The Honorable Professors of Othorhinolaryngology Head and Neck Surgery Department, the Honorable Coordinator of Othorhinolaryngology Head and Neck Surgery Department Study Program, Senior Staff Members, and dearest residents. It gives me great pleasure to welcome all of you to this inauguration ceremony of our Adjunct Professor, recognized by the Otolaryngology Head and Neck Surgery Department, Faculty of Medicine, Universitas Airlangga, Dr. Sutomo, General Academic Teaching Hospital. Welcome to our special guest, Prof. Seok. Thank you for joining us today. Othorhinolaryngology Head and Neck Surgery Department is a part of Universitas Airlangga, is determined to establish Tridharma University, consists of education and teaching, research and development, community service. And implementing the second point, research and development, we had our program to invite adjunct professors from well-known universities around the world to share expertise in escalating our competency in conducting and publishing more research. At the time, it is Prof. Seok from Department Othorhinolaryngology, Yonsei University College of Medicine, Seoul, South Korea. We believe this program will improve the quality of our doctors, improve the rank of submitted journal, improve the grade our medicine faculty, and provide golden opportunity for Universitas Airlangga to develop international collaboration and step in the right direction to become world-class university with the motto excellent with morality. Once again, we would like to thank you, Prof. Moon, and we are delighted to have you for the program. I would like to thank the committee chair chairman, committee members, and all of who have supported this event. We hope today's event will run smoothly and inspire us all. That's all from me. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Dr. Muhtarum Yusuf. Next is welcome speech by Dean of Medical Faculty, Universitas Airlangga, to Professor Dr. Budi Santoso, Gynecologist Consultant. The time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Rector of Universitas Airlangga, represented by Vice Rector Universitas Airlangga for Internationalization, Digitalization, and Information, Muhammad Miftahul Surur, Medical Doctor PhD. Also, Professor in Sokmun, Medical Doctor PhD. And with respectfully, Director of Sutomo General Hospital, Director of Universitas Airlangga Hospital, the Head of Othorhinolaryngology, Head and Neck Surgery Department, the Professor of Othorhinolaryngology, Head and Neck Surgery Department, and all of our distinguished invitation. On behalf of the Fakultas Medicine Universitas Airlangga, I would like to welcome all of you, and I would like to express my gratitude to Professor Moon become the adjunct professor in Department Othorhinolaryngology, Head and Neck Surgery of Faculty of Medicine Universitas Airlangga. As I heard, Professor in Sokmun is a professor who has background neuro-otology. His research interests are around endoscopic ear surgery, scalpel surgery, and auditory implant. He has not less than 107 publications with high index of 15. Since his high in well reputation in education, activity, writing, and also staff capacity building, hopefully many publications of paper in international journal will produce. All of those achievements will not only improve our achievement, but also increase faculty and our university performance. I expected that all of this activity will continuously run as our honor to Professor Moon. We would like to not only education network in give lecture to undergraduate and graduate students in department and study program in our faculty, but if there are any academic activity in other faculty in Universitas Airlangga who need the expert of the Professor Moon, he may be useful in other faculty in Universitas Airlangga. Once again, welcome to Faculty of Medicine Universitas Airlangga, and thank you to become our partner. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Budi Santoso. Next agenda is scientific oration by Professor In Sokmun, entitled Artificial Intelligence and Virtual Reality Application to Otologic Surgery in New Normal Era. To Professor In Sokmun, you may begin your oration.
Thank you for inviting me to this nice online meeting. Today's my talk is AI and VR application to otologic surgery in this new normal situation. Last year, huge epidemic hit us, the COVID-19. So we have been reluctant to meet, eat, talk each other, and academic exchange was also limited. Social distancing was biggest agenda in last year. But even until up to now, in the otolaryngology, we need to do close observation of nose, throat, and ear, which could be most risky part. Of course, we can use the PPE in the clinic, but it's very tough. Can you imagine wearing those for 8 hours per day? And these days, people say that the 5G era will come soon. So we can use this crisis as an opportunity to conduct telemedicine. This challenge was started several years before and accelerated by this COVID situation. Last 2 years, I was engaged several things which I want to introduce today to audience. They could be divided as two categories. They are artificial intelligence and virtual reality. In terms of AI, we could think about automated diagnosis, telemedicine trial, and decision-making support. Before jumping into the content, let us make a definition of several important words. Telemedicine refers delivery of healthcare service to people who live very far. And also, WHO 2010 suggested that telemedicine not only cover diagnosis, treatment, and prevention of disease, it could cover research and education. So that's the telemedicine. Artificial intelligence, based on the definition of Oxford Dictionary, is a computer system able to perform tasks that normally require human intelligence. Today, I will focus on my previous project, which used machine learning. First topic is automated diagnosis. This was published in eBiomedicine in 2019. If we can focus on the Otology, the flow of clinic like this. First, patient visit the clinic, and then we can do the history taking and the symptom checking. Then the examination of eardrum is the first gateway. Previously, we used the otoscope. Nowadays, we prefer auto-endoscope. Based on this drum finding, we can do additional tasks. Sometimes we decide to medical treatment or surgical treatment, and sometimes we recommend additional imaging or hearing test.